The following episode is brought to you by the American Urological Association. This special episode is all about the Society of Women in Urology meeting at the 2026 annual meeting. Keep listening to hear about the agenda and the main clinical areas being highlighted from Dr. Amy Luckenbaugh, President of the Society of Women in Urology.
Welcome to another episode of the AUA University podcast. I'm Dr. Mark Gonzalgo, Professor of Urology at the University of Miami and Chair of the AUA Office of Education. Today's discussion highlights the Society of Women in Urology, or SWU, and its programming at the upcoming AUA2026 annual meeting in Washington, D.C. SWU has played a critical role not only in advancing the careers of women in urology, but also in shaping broader conversations around mentorship, leadership development, workforce diversity, and innovation across our specialty. As urology continues to evolve, organizations like SWU are central to driving meaningful progress both clinically and culturally. I'm especially pleased to welcome today's guest, Dr. Amy Luckenbaugh, who currently serves as president of SWU. Dr. Luckenbaugh is professor of urology at Vanderbilt University and is widely recognized for her leadership, her contributions to academic urology, and her commitment to advancing both patient care and professional development within our field. Amy, welcome, and thank you for joining us.
Thank you so much for having me. It's a pleasure to be here.
Let's dive in and start with the big picture. For listeners who may be less familiar, can you give us an overview of SWU and what unique value it brings, not only to its members, but to the broader urology community?
Absolutely. The Society of Women in Urology is an organization that's really geared around supporting and representing women in urology with the goal of kind of creating gender equity in our workforce. We promote women at all levels, starting with medical students up to full professors, to help them succeed as kind of an underrepresented group in urology. Really, our ultimate goal would be for the organization to be obsolete and unnecessary, and that's what we work for.
How has SWU evolved over time? I think from your standpoint, being an organization and now its current president.
Gosh, it has grown tremendously since I joined. I first joined as a resident member in 2015, and I have actually been on the board almost 10 years now. And through that time, we've seen huge growth in our membership. The largest growth in our membership has actually been at the medical student level and the resident level. But overall, the membership has really grown, and our meeting, that is our winter meeting usually, is our really key deliverable when everybody really starts to, we've seen a surge in that membership and the number of people who attend.
I think that's amazing, and it's nice to see an organization like SWU generate momentum and grow over time. You know, I have one other question related to the organization, and I think from a high level and your perspective, how does SWU and involvement with SWU translate potentially for better patient care and stronger urologic care delivery?
That's a really great question. I think that there's been a lot of research that has shown that patients feel comfortable with doctors who look like them, whether that's right or wrong. And so having women treat women patients, but also treat all types of patients is really important. It brings a different perspective. We've seen a lot of the push for transvaginal estrogen, removing a FDA warning, and a lot of that stems from women advocating for women. So having that available to our patients and promoting women to positions that high of a level that they can make that impact is really impactful for all of urology and for our patients.
Great. And, obviously everyone's excited about the upcoming annual meeting in Washington, D.C., and SWU has a definite program on the agenda. What should attendees expect from that meeting at the annual conference, and what makes this year's meeting particularly compelling?
Yeah, we are really excited about this meeting. Our annual breakfast meeting is another thing that has really changed since I started. The annual breakfast meeting at the AUA used to be pretty small and just SWU members, and now it is open to allies as well. So please, everyone who is a SWU member or ally, come to our breakfast meeting. This year, we'll be giving our annual awards, a leadership award, a mentor award, research awards, and a resident awards. Dr. Ree, the AUA president-elect, will be speaking. But what we're most excited about is having Dr. Reshma Jagsi, the chair of the Department of Radiation Oncology at Emory, speak. She's speaking about optimizing the success and vitality of women in academic medicine. She's really known for her research in gender equity and is a really sought after speaker in this area. So we're excited to be able to have her and really lucky to have her.
Great. And you mentioned, involvement of several groups within urology. For this meeting at the AUA annual conference, who should make a point to attend?
Truthfully, anybody, everyone is welcome. We would really love to see any male allies come out, chairmen, program directors, and to see and to highlight everything SWU has done this year and is aiming to do. And Dr. Jagsi's talk, I think, will be really awesome. She's incredibly hard to get to book. We've tried multiple years, so this is the first year we've been able to get her. So we're pretty excited. So I would encourage anyone to come and listen.
Wow, great. It sounds like for busy clinicians attending the AUA, that keynote address is certainly one session that they shouldn't miss.
Yes.
So let's shift now to the clinical side of things. From your perspective, what are the main clinical areas being highlighted during the SWU meeting this year?
So SWU is a little unique in that we are primarily highlighting our mentorship and our professional development during our meeting this year. We will be giving out our research awards, and there will be research talks that will be given, but the primary focus will be more on the professional development aspect. Specifically, truly the keynote speaker is where it is going to be, and I think she may have advice for physicians of all levels on how they can help and promote and help women succeed in urology.
Great. And, are you going to be focusing along any time at the meeting on subspecialty highlights or any updates or health disparities outcomes research?
We will not have a lot on that topic at this meeting. I think that we aim, as we do each year, to work to make our organization unnecessary. And each year we do take a chair photo of all the women chairs in the country, and that number continues to increase. We've had some pretty awesome photos and turnout from women chairs. So I think that is also something we're planning to highlight at the meeting.
Got it. That's very exciting. Now, you're deeply involved in obviously your particular subspecialty, which is urologic oncology. I'm not sure if you have anything that you could share with the listeners on what is new or particularly exciting on the horizon in this area.
Oh, goodness. Yes. I think that perhaps the most exciting thing in urologic oncology is the ever-changing world of bladder cancer. So the options for non-muscle invasive treatments seem to multiply by the minute. We have so many exciting options to help patients preserve their bladder. And then in the muscle invasive space, I think the shift in giving enfortumab vedotin and pembrolizumab as neoadjuvant chemotherapy is a huge paradigm change. And I think we as urologists need to keep our name and keep our foot in the game and trying to figure out what is next for patients who receive EV Pembro up front. If they have a 57% pathologic complete response rate, I think that our medical oncology and radiation oncology colleagues are going to be pushing for bladder preservation. And in some cases that may be appropriate, but in others it may not. And we need to stay in the game and stay talking about that to make sure that our patients are getting the appropriate treatment and getting surgery when they need it.
Yeah, I agree. I think it's a particularly exciting time in the field of bladder cancer, as you mentioned, both in the non-muscle invasive as well as the muscle invasive space. I can't remember a time, at least during my career, where there has been so many new treatments that have evolved over such a short period of time. And you mentioned the involvement of medical oncologists, radiation oncologists, one of whom obviously is your keynote speaker at this year's annual meeting. So it will really highlight, again, the need or emphasize the need for multidisciplinary care when we're dealing with all of these patients.
Absolutely.
So as we wrap up, what kind of message would you like to leave with our listeners, whether it's related to SWU, your subspecialty, or professional development in urology?
I primarily want to leave with that we as the Society of Women in Urology and I've said it now, I think this is my third time, our goal is to not exist. Our goal is to have things be equitable and to not have to think about this and just be able to practice excellent urology. And we would love to see you at our meeting at the AUA. The program starts at 7:30 and the keynote speaker is at 8:30. So we would love to see you there.
Great. I have my final two questions for me are what advice would you give to trainees or early career urologists, and how can listeners get more involved with SWU?
So advice to trainees and early career urologists is this is not related to SWU at all, is to get as many cases under your belt, get as many experiences under your belt as you can early on. And the sooner you do that, the more and more comfortable you become in your own skin as a new attending. And same thing applies to residents. And then how can people get more involved in SWU? SWU.org is our website, and there is a place that you can read all about us there. You can reach out if you have questions. You're welcome to reach out to me, and we would love to see you at the breakfast meeting this year, and we'd also love to see you at our annual winter meeting in next January.
Amy, thank you for being here today and for an outstanding discussion. Your insights really highlight the important role that SWU plays, not only in supporting the professional growth of its members, but in shaping the future of urology as a whole. For our listeners, this is a great reminder that meetings like SWU at AUA 2026 are not just about education, they're about connection, perspective, and advancing how we practice and lead. To our audience, thank you again for joining us today. For more educational content, including podcasts, courses, and meeting highlights, please visit auanet.org/university. I'm Dr. Mark Gonzalgo, and we look forward to bringing you more conversations that inform, challenge, and inspire your practice. Until next time, thank you.